This screencast covers substance-related disorders. This is one of my favorite topics, and actually this year we should be introducing a new class which will be called Drugs and Behavior, which will specifically look at substance abuse, substance dependence, but more importantly, how drugs actually work in the body. So if you're interested in that course, check it out. Maybe sign up for that. If you like this topic, we will go into far more detail. I mean, as you know, substance related problems are very prevalent in our society and around the world, and really always have been. So there's no society on earth that does not use substances in one way or another, but I want you to think about that. I keep saying substance. What does that mean? Actually, think about what is a drug. I want you to take a minute and think. How would you define what a drug is? I mean, seriously, take a second. Think about it. What is a drug? Now, usually in class, students will say something to the effect of, well, it's something taken to treat a disease. And I'll say, okay, well, what about alcohol? Is alcohol a drug? And usually I get most students say, oh yeah, sure. But a lot of other students will say, no, alcohol is not a drug. And then I'll say, well, what about marijuana? And then they'll say, yes, that's a drug. And I'll say, well, is that intended to treat a disease? Some students will say no. Other students will say, oh, yes, it is. It's used to treat the symptoms of glaucoma and nausea and anorexia in cancer patients, stuff like that. And I'll say, yeah, you're right. That does work. But think about the problems with defining a drug as something that is used to treat an illness. And a lot of the illicit drugs, I can tell you how we can use them to treat an illness. Even something like heroin, which you think would be strictly a recreational drug, was created by the Bayer pharmaceutical company, like Bayer aspirin. And it was used to treat just about everything under the sun, from a headache to menstrual cramps to a cold. And heroin has medicinal properties. I mean, think about it. What is the number one thing that it could be used for? Well, it could be used to treat pain. I mean, heroin is an analgesic, a pain-relieving drug. And again, go back to that question. So how do we define what a drug is? And it's getting confusing, and I'd like to make it even more confusing, because at this point, maybe in your head, you're going, oh, okay, wait a second. A drug is any substance that changes the physiology of your body. Good answer, right? But think about this. What does water do in your body? I mean, water changes your physiology. Is water a drug? Is food a drug? Well, Hippocrates said, let food be thy medicine. So maybe he thought of food as a drug. And there's lots of things that are kind of like half food and half drug. Something like a psilocybin mushroom. It's a mushroom, you could eat it, but it's going to make you hallucinate. So a portobello mushroom at the grocery store, that'll change your physiology too. Is that a drug? I don't know. I don't think so. It's hard and it's confusing. So, I mean, I think of a drug as something that is taken to either diagnose, treat, or cure an illness, or something taken recreationally to impair consciousness. I mean, that's the best way that I can describe it right now. My definition might improve in the future, but that's what I'm going with, and that's what I want you to think of when I say substance. So substance abuse is not just marijuana, heroin, cocaine, methamphetamine. I also want you to think about things that are totally illegal, like caffeine, nicotine. In tobacco, I want you to think about alcohol as a substance also. And when we talk about abuse versus dependence, in the psychology field, we don't really use the term addiction. So addiction is not in the DSM. What we differentiate between is substance abuse and substance dependence. And really, the major difference between the two is that dependence, both of these are going to have some adverse effects on your ability to work, love, or play. We've talked about that earlier. So that's how we know it's an abnormal behavior. But dependence is really marked by two things. One is tolerance. And I want you to know that tolerance is your body building up. A lot of students will say immunity. That's not the right word. I want you to think about like balance or homeostasis, or a little more advanced, we call it allostasis. And what the body does when it's confronted with a substance, it adapts to that substance. So let's do another example, like water. Oftentimes in class, I'll have students that bring in these giant, like 2-gallon jugs of water, and they're drinking water all day, every day. Your body likes to maintain balance. So if you're consuming that much water, what does your body do? Well, those are also the students that are running to the bathroom like every 15 minutes. And even though that student has taken in so much water, if they stop drinking water right away, their body has compensated for the introduction of all that water. And they'll get dehydrated. So think about somebody that chronically uses alcohol. You know, you could take somebody, they've never used alcohol before, you give them 2 drinks, and they're going to be hammered, to use a technical term. But pretty soon after drinking 2 drinks, their body learns strategies to compensate for the alcohol on board. And this is a number of different physiological behavioral strategies. And now they can drink 3 drinks before feeling the same effect. And then it's up to 4, and then 6, and then 8, and 10. You know, it just goes on. That's what we call tolerance. So it's a reduced effect of a substance after multiple uses, or a reduced effect like with the same amount. If any of you smoke cigarettes, you might realize that you develop tolerance very quickly to nicotine. You might have had 1 cigarette in the beginning and you could really feel the effects, and now you might not feel it at all. But what happens when you have tolerance is that when you stop using the substance, you have the effects of withdrawal. And withdrawal is almost always the exact opposite of the active effects of the substance itself. So let's say you were taking, let's do an anti-anxiety medication. Let's say your doctor prescribed it, you're taking it as prescribed, but you have reduced effects of the drug after a while. So your doctor might prescribe you a little higher dosage. You've developed tolerance to that. And then let's say you run out of your prescription really quickly. So your anti-anxiety medication makes you feel, how does it make you feel? Well, let's see, you might be tired, and you might sleep really good at night, and you're not going to feel anxious at all. Those are the active effects. In withdrawal, how are you going to feel? And the answer, again, always go to the opposite. You're going to feel super anxious. You're going to have insomnia. You're not going to be able to sleep. So tolerance and withdrawal are what characterize substance dependence versus substance abuse. Okay? So know those terms, understand them. And then substance intoxication is pretty simple. That's when you have altered levels of consciousness due to a substance that you took. And with different drugs, it can be mild or A lot of drugs can kill you. They'll put you into a coma, like alcohol. And there's different levels of intoxication. So at the extreme end, you might have someone that's in a stupor. And a stupor is like a medical term. And then that might be followed by a coma. So you are very intoxicated. Okay, what is that thing right there? Does that look like a meth lab? Nope, not a meth lab. Maybe you've been watching too much Breaking Bad. That right there is a still. So, we need to talk about alcohol. Okay, alcohol is one of the most widely abused substances on the planet. A lot of people don't think of alcohol as a drug, but alcohol is a drug. And alcohol, frankly, is terrible for you in large quantities. There's lots of research that shows small amounts of alcohol might have some positive health effects, but in large amounts, alcohol is toxic to like every single system in your body. So just be aware of that. And alcohol is dangerous. If you really look at the number of deaths that are associated with any type of drug, combine them all up, and alcohol is far more dangerous. I should say illicit drug. So alcohol is really a deadly drug, and you can drink yourself to death really pretty easily. So let's talk about alcohol a little bit, how it originated. Well, not how it originates, but how we get alcohol is pretty simple. And so if we talk about beer, let's use beer, we'll start there. What is beer? So beer, we take grains. So when you're driving around Wyoming, look around, you'll see lots of grains out there when you see some farmers' fields. And so you can use barley and wheat and just about anything. Now those grains have sugars in them. So you mix the grains with hot water and you extract the sugar out of the grains. That's basically all you need to do for step one. And so something like wine, you take grapes and you extract the juice out of the grapes. The grape juice has sugar in it. And then you move to the next step, which is the introduction of yeast. So what yeast does is it eats sugar. That's what yeast do. So yeast consumes the sugars, and then the byproducts of the yeast eating the sugar are carbon dioxide, which comes out as a gas, and alcohol. And so humans discovered that long ago and realized that substance had some psychoactive effects, and heck, it's been around ever since. So what we can do with, like, let's say we have the grape juice that we have fermented with the yeast, you can take and distill out the alcohol, and this would be a still. So you put like the grape juice here, or you could do fermented potato water, or just about anything. And then you heat that to a certain temperature, and the water and the alcohol vaporize, and they go up the still here. You cool that down really quickly, and the alcohol is going to condense first. So you can have the alcohol run off here, and then you can get higher concentrations of alcohol than you can with beer or wine, because once you hit like, getting close to like 20% alcohol, it kills the yeast and they can't ferment the substance anymore. But you can achieve higher alcohol concentrations through distillation. Okay, so alcohol has a number of different effects. If you look at the neurotransmitter systems that alcohol works on, it is like a shotgun in your brain. So it works on dopamine systems. It works on GABA. It works on It works in the opiate system. So, I mean, and there's a lot more. Alcohol has a lot of different effects in the brain. So, its immediate effects, it can be sedating. It can have central nervous system depressant activities. But you might notice that some people get angry or aggressive. Well, it has disinhibiting properties as well. So, those folks are probably angry and aggressive to begin with. Alcohol facilitates aggression like no other. I mean, it doesn't cause you to be aggressive, but if you have those aggressive tendencies to begin with, alcohol facilitates that. And if you look at the incarcerated population in the United States and look at how many of those folks, the percentage that were using alcohol at the time that they committed the crime is absolutely staggering. It's incredible. Alcohol can be fatal in excess. That's always scary for me as a college professor because I see my young students that are naive about the effects of alcohol, and they're really at risk of alcohol poisoning and even death that's alcohol related. So, another scary thing is that people oftentimes mix other substances with alcohol, which can cause potentiation, and it can compound these effects. Like alcohol and benzodiazepines, or those anti-anxiety medications, can be absolutely fatal when combined. I mean, I have to say that again. If you combine things like benzodiazepines like Xanax or Valium or Klonopin or Ativan with alcohol, those things in combination can be fatal because they all sedate the central nervous system and you can stop breathing. Unfortunately, I've known a handful of people that have died that way, and it is very serious. So, other drugs like pain medications and opiates in combination with alcohol can seriously be potentially fatal. Alcohol does have some long-term effects. Alcohol use is related with some diseases like dementia, specifically Wernicke's disease or Korsakoff syndrome. But what happens, and this is really fascinating, it's not the alcohol itself that causes these problems. What it's associated with is the lifestyle. So somebody is drinking excessive quantities of alcohol, and one thing that happens is that they might stop eating, and so they'll have nutritional deficits. Korsakoff syndrome is caused by a vitamin B12 deficiency or thiamine, and so the individual just drinks alcohol and excludes food from their diet, and it's the nutritional deficiency that causes the disorder, not the alcohol itself. So alcohol, however, is, again, toxic to just about every system in your body. You can have major problems with your liver failure, cirrhosis of the liver. Actually, combining alcohol and acetaminophen together, which is Tylenol, is the number one cause of acute liver failure in the United States. Your liver does not bounce back from that one. You are in big trouble if you have that problem. So never, ever, 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 ever combine alcohol with Tylenol and or acetaminophen. And acetaminophen is in a huge number of over-the-counter products for cold, sleep, stuff like that. It can have serious effects on the gastrointestinal system, bone density, muscles, and the immune system. When we talk about people that have alcohol abuse or alcohol dependence, there is a strong genetic component to that. However, there's a lot of environmental factors at play as well. People with different genetics are affected by alcohol in different ways. It's just the way that your genes are. So we can look at your liver, which metabolizes all the drugs that you have in your body, including alcohol. Liver metabolism of alcohol is different between different ethnicities, depending on your genetic makeup. So if you have any Asian friends, this is not a joke, this is something very serious. Take your Asian friend out to the bar and have them have a couple drinks, and you will see that they will be more impaired than, say, your Caucasian friend that you have taken out to the bar with you. Obviously, make sure they're 21 before you run this little experiment, but Asians don't metabolize alcohol as well as Caucasians do. So there's something called Asian flush syndrome. And your Asian friend's face might be red and they might be sweating a little bit because the alcohol affects them differently. So some people metabolize alcohol really well and will not have hangovers in the morning. Other people do not metabolize alcohol very good and will have vicious hangovers in the morning. So there's genetic factors around the board when we talk about alcohol use. There are a number of medications that are used to treat alcohol dependence. Naltrexone is an opiate agonist that is used to treat cravings for alcohol. Disulfiram is a drug called antabuse. I love asking questions about disulfiram or antabuse. What disulfiram does is it blocks the metabolism of alcohol, and so what you have is a buildup of a toxic substance that accumulates through the process of alcohol metabolism that is normally broken down into acetic acid, but it builds up in your system and it gives you like a super mega hangover. So you get incredibly sick, even with small amounts of alcohol. The problem with this, though, is you can just not take it, so you don't have the effects. But sometimes you have a problem with, like, a spouse might slip this in your orange juice in the morning, and you might have slipped some vodka in your orange juice in the morning, and you take those in combination, and you're going to be extremely ill. I'm talking like hospital ill. And then acamprosate is used during withdrawal. Acamprosate is a NMDA and GABA receptor antagonist, and it's supposed to lessen the likelihood of relapsing after withdrawal. But acamprosate, yeah, I mean, there's research evidence that it works, but in combination with a traditional therapeutic, like psychological interventions for addiction. Okay, so what we really need to talk about, and this slide probably should have been before alcohol, but all drugs of abuse, every single drug of abuse, every drug that people abuse on the planet, and even behaviors that become addictive, like gambling or shopping or sex or something like that, all those behaviors increase levels of dopamine in an area of the brain called the dopaminergic mesolimbic system. And that's this little pathway here from the nucleus accumbens to the ventral tegmental area. And don't worry, you don't have to remember dopaminergic mesolimbic system. That's kind of long. What I want you to remember is the pleasure center of the brain. Okay? So this area is involved in reward and reinforcement. So anything that you do in your daily life that is reinforcing, like drinking Coca-Cola or eating chocolate or having sex or watching TV or exercising or mountain biking or skydiving, whatever it is that you like to do, and it's different for different people, releases dopamine in this area of the brain. And drugs of abuse hijack this system. Okay? So let's say, what's your favorite food? Okay? For me, I don't know. It's Taco Bell. And where I live, unfortunately, there is no availability of the delicious food from Taco Bell. But I love Taco Bell. When I eat Taco Bell, I get a little boost of dopamine. It's very rewarding to me. So dopamine is released in the system of the brain. The receptors bind there. These brain circuits are for natural rewards. It makes me feel good. The same thing could happen with music. I like to listen to live music. It makes me feel good, or art, or whatever it might be. You get dopamine activity in this area of your brain. Okay? So, what happens with drugs? Well, drugs hijack this area of the brain and either directly or indirectly increase levels of dopamine in this area of your brain. So let's go over here. Let's use cocaine, for example. All right, so this is a presynaptic neuron up here. Neurotransmission goes this way. And what cocaine does is it blocks the dopamine reuptake pump here. This actually works in a very similar way that the SSRIs like Prozac work to increase levels of serotonin in the synapse. So this pump is stopped right here. So it can't suck dopamine back up into the presynaptic neuron. So you get a huge increase in the amount of dopamine that is in the synapse. That's what cocaine does. Now it has some other properties. It has some analgesic properties that we'll talk about maybe later. But dopamine just increases. Dopamine increases in the mesolimbic system, the brain's pleasure center, as a result of cocaine use. So cocaine directly increases the amount of dopamine in that area. Methamphetamines do this, along with a couple other things. Again, every single drug of abuse increases dopamine in this pleasure center of the brain. And it hijacks that pleasure center of the brain. So natural rewards, like food, aren't quite as rewarding anymore because dopamine is increased a whole heck of a lot more when you do cocaine versus eating at Taco Bell. So that dopamine increase is exaggerated, and it alters communication in that area. Now, the next thing that happens, think about this, if you're constantly doing cocaine, your body compensates by a number of different things, but there will be less activity with the dopamine after a while because your body needs to respond to this huge overflow of dopamine in the synapse. So you develop tolerance, and then when you go to withdrawal, so think about in withdrawal, there'd be like no dopamine activity in the synapse whatsoever. How does cocaine make you feel? Energetic. In withdrawal, how are you going to feel? Like you have no energy. Cocaine might make you feel happy. How are you going to feel in withdrawal? You're going to be depressed and miserable. Cocaine makes you feel like you have a lot of energy. In withdrawal, you're going to feel lethargy and fatigue. So think about how that works. Okay, other stimulants, amphetamines, methamphetamines, cocaine. Methamphetamine is, well, let's just say it's probably not good for you. And on the same token, and I want to be very careful saying this, methamphetamine is like a miracle drug. Imagine a drug that you could take that could keep you up for 2 days. I mean, if you were a bomber pilot in the Air Force or something like that, amphetamines are like a lifesaver, literally. But it's when those drugs are misused and chronically misused that you can see damage to the brain. So, I mean, could these things be used medicinally? Yeah, for sure. And there's really not that much difference between amphetamine and methamphetamine. It's just a methyl group. So methamphetamine works a little quicker, lasts a little longer. But again, I want to make this point very clear. It's not like the drug itself that's evil. No drug is evil, but it's the way that people use the drug. And you can absolutely 100% misuse a drug, abuse a drug, and ruin your life with a drug. Okay, so this right here is another drawing of the neurons, just like I talked about in that last drawing. So cocaine here blocks the reuptake transporter pump and increases dopamine in the synapse. So all drugs do that. How about this thing right here? What is that? Little pop quiz. Because a lot of students will scream out, "This is not a drug," and this is marijuana. Marijuana absolutely 100% is a drug. I don't care if it comes from a plant. All sorts of drugs come from plants. Marijuana is a drug, and marijuana increases levels of dopamine in the brain's pleasure center, just like all other drugs. But I mean, there are some arguments that people use to say that marijuana is safer than other drugs, which, frankly, as a professor, I would agree with. You can overdose on a bottle of Jack Daniels and kill yourself pretty quickly. It's almost impossible to overdose on marijuana. Literally, you'd have to ingest a dump truck load. So, I mean, in some ways that's safe, but marijuana is a drug. Absolutely is a drug. And if it was discovered today, the pharmaceutical industry would jump all over it because it has some medicinal properties that are very beneficial. So marijuana is the plant form. There's another form called hashish, which is, if you go back here, and you can't really see it here, but there's if we were able to zoom in, let's see if I can zoom in a little bit. You'll see little crystals on the marijuana plant. You can't see it right here. Those crystals contain THC, and hashish is a concentrated resin glands, which are called trichromes from the marijuana, concentrated with that the psychoactive substances in it, and it doesn't have the plant matter in it. Okay, that's hashish. So there are some negative effects of marijuana, and I really want to make the point that the research with marijuana is really mixed. So there's contradictory evidence all over the place. So it's really hard for me to say definitively this happens or this does not happen. But if you look at the acute, residual, and long-term effects, there's okay, so look at the chart. Attention and concentration. Acute effects in a light user, it's impaired. You're going to have impaired attention and concentration. But in someone that's used to smoking marijuana, they'll be normal. Residual lasting effects, mixed findings. And then long-term effects, normal. Decision-making and risk-taking. Now, I want to make a note here that there's evidence that shows that residual and long-term effects are that this decision and risk-taking is impaired. But think about the chicken versus the egg. And I think you would agree that people that are more risk-taking and might not make the best decisions are probably more apt to use marijuana. I mean, it is. You could probably argue with me that it's a very safe drug to use, and I would agree. However, the legal ramifications getting caught with marijuana can absolutely ruin your life. So, I mean, it's a smart decision to stay away from all illegal drugs, including marijuana, because you can get arrested for it. You can go to jail. So again, think about chicken or egg. Inhibition, impulsivity, acute effects like while you are intoxicated, impaired, but residual and long-term effects, there's mixed findings. Working memory is impaired while you're intoxicated, but is normal afterwards. And then verbal fluency is normal in the acute stage, but mixed findings and long-term effects. Okay, what is that? Let me go back really quickly and talk about the medicinal properties of marijuana. And the FDA has a drug that's FDA approved called Marinol, which is THC that is used as an anti-nausea medication. And it's funny because THC is a psychoactive component of marijuana. There's other compounds that are called cannabinoids, and those cannabinoids people suggest are where a lot of the medicinal benefits from the marijuana are derived. So, it'd be interesting to see if the FDA changes anything, but at this point in time, we have a huge number of states that have legalized medicinal marijuana, and it's not like a doctor prescribes the marijuana for you. A doctor will sign off on the state paperwork saying that it is okay for you to use marijuana medicinally, and then the state will approve that for you as an individual, and then you obtain your marijuana through whatever the state has deemed to be the appropriate way, whether that's a dispensary or person-to-person transfers. But marijuana is really good at reducing intraocular pressure, like in glaucoma. It is excellent at reducing nausea. It is excellent at increasing appetite. So a lot of diseases, anorexia, like cancer, HIV, people just don't want to eat. And marijuana can stimulate appetite. And then, as we go on, there hasn't been a ton of clinical research on marijuana. It's kind of unfortunate, but, there's evidence that it might help with epilepsy and the symptoms of a lot of other neurological disorders. However, I'm not recommending this. I would say approach with caution and wait till there's more research and make an informed decision based on that. Okay, now what is that? Any guesses? That is peyote. It comes from a cactus. These are all hallucinogens. So LSD, lysergic acid diethylamide, peyote, psilocybin, and PCP, also called phencyclidine. Those are all hallucinogens. So here is MDMA, 3,4-methylene dioxy, and methamphetamine. You can see why they go by the abbreviation MDMA. Actually, I want to make a note that's what on the street is called ecstasy. However, ecstasy is a conglomeration of a number of other drugs, including methamphetamines, synthetic amphetamines, hallucinogens, all sorts of stuff. So even though someone says ecstasy, Sometimes it is MDMA. Sometimes it can be something very, very different. All of those drugs are chemically similar to methamphetamine and mescaline. Most hallucinogens work on the neurotransmitter system, serotonin. Okay, next one. What is this? Any guesses here? This is a flower. Actually, I should have put a picture of the flower in here, but I didn't, so Google it. That is a poppy flower. And so this is the pod of the poppy plant. And what people have done, and have done for a long time, is that they score the outside of the poppy plant, and this white milky substance comes out. You let it sit there for a while. It turns brown in the sun, and then you collect that. And this stuff right here on this knife is opium. And so opium is really codeine and morphine. So there's codeine and morphine in opium. It has approximately 12% morphine, and then I think the number is like 80% codeine, and then there's other substances in there like thebaine. So that is how we get codeine and morphine. It is derived from the poppy plant. And then we have other drugs that are, well, let's start with heroin. And heroin was created by the Bayer Pharmaceutical Company. At that time, we had a number of people that were addicted to morphine, and they were trying to figure out how to create a drug that could get people off of morphine. They added 2 acetyl groups to morphine to create diacetyl morphine, which we know as heroin. And well, they gave it to people to try and get them off morphine, and unfortunately that did not work. Oxycodone is a semi-synthetic opiate, and that is derived from that third compound, thebaine, from the poppy plant. So a lot of times you'll hear the term opiate. Opiates are from the poppy plant, or opioid. You'll hear that term too. Those terms, opiate and opioid, are kind of confusing. I mean, if you really want to get technical, you should use the term opiate for the natural substances that come out of the poppy plant, which are alkaloids. So like codeine and morphine would be opiates, and then opioids would be like heroin, oxycodone, and hydrocodone. Oh, I forgot to tell you that hydrocodone is derived, again, semi-synthetic, just like oxycodone, but hydrocodone is derived from codeine versus thebaine. So, can you ruin your life with these drugs? Absolutely. Are these drugs evil? No. Are they used in bad ways? Yes. Are they like miracle drugs? Yeah, absolutely, in some way. However, you take them in the wrong way, and they hijack your brain, and they can take over your life. They can kill you. The major reason that these drugs are used is for the reduction of pain. They are analgesics, and they work really good at that. But there's lots of other side effects that happen, like heroin. You take heroin, your nose will dry up. Heroin was used in all sorts of patent medicines, like cold medicines. So if you have a runny nose, heroin will dry that up. If you have diarrhea, heroin will make you constipated. And if you can't sleep, heroin will put you to sleep. But think about, like, you become addicted to heroin, and then what happens in withdrawal? So you get really, really sick. Your nose will be running, you'll have diarrhea, you'll have insomnia, you'll be hypersensitive to pain. It's really unpleasant. Sedatives, hypnotics, and anxiolytics sedate, go to sleep, and reduce anxiety. So sedatives have a calming effect on the central nervous system, sedating you. Hypnotics induce that sedation, aka make you fall asleep. And then anxiolytics, anti-anxiety medications. Let me go back to those really quickly. I probably should have a couple more slides on these. All of these work on GABA. GABA is a universal inhibitory neurotransmitter, and so they facilitate or increase the effects of GABA, and they sedate you. So think about anxiolytics. You take your anti-anxiety medication, you develop a tolerance to it, you run out, what can happen? Okay, what drug are we talking about here? That's right, caffeine, the most widely abused substance on the planet. Caffeine comes in all sorts of different sources, but coffee is a major source of caffeine. Also tea, chocolate. It's added to energy drinks and diet pills and headache remedies as well. Even like a lot of the drugs for like PMS have caffeine in them. So caffeine does a great job at fighting fatigue. So it increases an individual's perceived levels of energy and alertness. But caffeine stimulates the sympathetic nervous system, so it can increase blood pressure, and it may lead to increased production of cortisol. And you don't want your sympathetic nervous system going all the time. That's your fight or flight system. That may leave you vulnerable to illness and disease. Okay, what's that one? That is tobacco, the second most widely abused substance on the planet. If you ask me, if you said, hey, Dr. Silk, what's the most dangerous drug on the planet? I would say tobacco. Unfortunately, tobacco is a killer. And a lot of students don't like to hear that because a lot of students smoke and chew tobacco and stuff like that. Now, nicotine, which is in tobacco, is safe. It's fine. I mean, I shouldn't say it's safe. You can overdose and kill yourself on nicotine, and it's really a relatively small amount of nicotine. But nicotine alone doesn't have the negative effects that the tobacco does. So nicotine is a psychoactive substance found in cigarettes. It stimulates the release of adrenaline. It increases blood pressure, heart rate, and respiration. But it's weird in that it can have a calming effect too. So like there's this two-phase activity of nicotine, but it also increases levels of dopamine a ridiculous amount. It is incredibly addictive, but it is the tar in the tobacco that contains the carcinogens. And it is ridiculous how dangerous tobacco is. I mean, in the United States, cigarettes cause 1 in every 5 deaths. So they can be attributed to the cause, and 1 in every 5 deaths. And then, okay, other major causes of death. Let's take HIV or AIDS, cancer, alcohol, motor vehicle accidents, suicide, and let's just throw in murder too. So add up all of those together. Again, so you have HIV, AIDS, cancer, Alcohol-related deaths, motor vehicle accidents, suicide, and murder. Add those all together. Tobacco kills more people every year in the United States than all of those other causes combined. So it's like roughly 500,000 deaths a year that are attributed to smoking. And, the estimates are that if you smoke cigarettes, it'll cut your life short by approximately 14 years. And I think that delay is what's responsible for people's, cognitively reducing the harm of smoking cigarettes. And I'll have students tell me, well, I knew this guy that smoked until he was 95 years old. Well, I don't care. That's fine. That's one person. But the data is really there. And hey, load yourself up with nicotine. It might even be beneficial to you. It might be a cognitive enhancing drug. Don't put 10 nicotine patches on because you'll overdose. But chew nicotine gum, take nicotine spray, nicotine replacement all day long. I don't care. That's not going to kill you, but the cigarette smoking will. So that is the most dangerous drug on the planet, hands down, in my opinion. And I think I have good evidence to back up why. You might not have thought that, but that's what it is. Okay, so these, what are these? You might never have seen these. These are kind of weird looking, and some of them have some odd names. What's that? If you've been to the dentist recently, you may have had your dentist throw a mask on you there. That would be nitrous oxide in the category of inhalants. Those other things were the street name. They're called poppers. They are nitrates. Those poppers are called alkyl nitrites. And they give the user an intense head rush and feeling of euphoria. People say that they are an aphrodisiac. I don't really know about that. You'll have to Google that or something. But there's lots of different gases, aerosols, and volatile solvents that are used as inhalants. This is a pretty bad category of drug. A lot of these can cause brain damage. But a lot of times it's because people don't breathe oxygen when they're using these things. I would definitely stay away. So that's a brief introduction to the substance use disorders. We talked again about substance abuse and substance dependence. So if you go and look at the DSM, there's going to be substance abuse and substance dependence for every single substance that we covered, along with 1,000 other substances. So the substance use disorders take up a huge number of pages in the DSM. Again, so the DSM will cover not just abuse and dependence, but also substance intoxication, and you specify which substance. There's intoxication, psychosis, withdrawal, amnesia, cognitive dysfunction due to, the list goes on and on and on and on. And then medications are thrown in there too. So check it out. Go online, look at the DSM, look at the substance-related disorders. It's really, really interesting. So at the end of this lecture, I always have to say, I do not advocate for the use, abuse, misuse, dependence of any substance at all. Clean, healthy living is very, very important because all of these things, what they do is they throw your brain out of balance, and that is not good. So they're all stressors on your system. There's negative effects of every single one across the board, even if you can point to some positive effects here and there. So that's very, very, very important. If you have any questions, please do not hesitate to ask. Take that take that drugs and behavior class if you're interested in this.